Welcome to Healthful Matters. I'm Christina Elgin. This week's topic is heart disease in women, and I'm speaking with Dr. Chris Vaccari from Hagerstown Heart. Did you know heart disease is the #1 killer of women, more deadly than any form of cancer? In fact, it is the cause of death of 1 in 3 women. I sat down with Dr. Vaccari and talked to him about heart disease, how it can be prevented, and the difference between a heart attack and a stroke.
It started out like a totally normal day.
Mom!
Okay, move objection deadline to the 3rd line after survey. Oh, honey, for where you are, you always use the verb estar.
What are you doing down there? Did you finish your breakfast?
Ow. Don't hit your brother. Honey, you have to eat something. Here.
Okay, 5 minutes to carpool.
Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah, here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please.
You know, go help your sister.
We're going in 3 minutes.
Oh, my God, what am I doing?
I forgot to cut off the crust. Voila. Shoes on, potty if you need it.
Honey, get your sister. Okay, here.
Nobody move.
I'm getting a dustpan.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down.
I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long?
2 minutes. Can you make it 10?
What causes heart disease in women, and how can it be prevented?
Heart disease is caused by high blood pressure, high cholesterol, diabetes is an important risk factor, and then smoking, age are also important risk factors, and then family history is an important risk factor. So in general, the risk factors are the same. Now, usually women lag behind men about 10 years in terms of the development of heart disease, and that relates more to the hormonal factors, which are not completely understood, that are more relevant for women than men. Well, heart disease prevention is usually through some of the improvement in some of these risk factors. So clearly the most important preventable cause of heart disease is smoking. So smoking cessation is probably the #1 way to prevent heart disease. But making sure you're seeing your doctor regularly, making sure your blood pressure, cholesterol is under control, making sure you don't have diabetes is important. But then, in terms of some of the other things like age and family history, which you can't control, it's just a matter of identifying your risk and also making sure you don't have the early coronary disease, or if you have symptoms that could be compatible with heart disease, making sure that those get recognized and diagnosed in a timely fashion.
If heart disease runs in your family, can it still be prevented?
I think if you can recognize and we can diagnose coronary disease before the first event, and a lot of times that's important because the first event can be a sort of catastrophic event. I mean, it could be, dying suddenly at home. If we can identify people before that first event using, some of the tests that we have, then oftentimes we can get people on the appropriate treatment, and that definitely does reduce your risk of having a cardiac event.
What is the difference between a heart attack and a stroke, and what are the symptoms?
Well, a heart attack is a blockage in an artery feeding the muscle of the heart, so one of the coronary arteries. And a stroke is related to a blockage in an artery feeding the brain. and once there's damage to the brain, that causes a stroke. So it's the difference between blockages in arteries feeding the brain versus the heart. In terms of a heart attack, the symptoms can be variable. I mean, it can be anything from chest pain all the way to no chest pain and shortness of breath. Some people have shoulder pain, jaw pain, stomach pain, nausea, vomiting, lightheadedness, a feeling like your heart's racing or skipping. So, in terms of the heart attack, usually the classic symptoms are a chest tightness, chest pressure, with some radiation into the left arm, into the jaw, associated with shortness of breath. That would be sort of the classic, but it can be any kind of variation of a lot of those different types of symptoms. So I'd say for at least a heart issue, if you're sort of concerned about some of the symptoms you're having, then a lot of times it's just a matter of getting to your doctor or getting to the emergency room to get that evaluated. In terms of a stroke, what you're looking at is more symptoms that are sort of weakness on one side more than the other. Sometimes it can be slurred speech, visual changes where you feel like one side of your vision is changed, or you feel a curtain kind of drawing over your vision, numbness, tingling on one side more than the other, but it's really an asymmetry to your symptoms, so maybe one side but not the other side. And in general, if you're having symptoms like that, you also need to get to the emergency room and make sure that you're not having a stroke.
What are the benefits of diet and exercise?
I think it's often overlooked, but it's critically important. We have a lot of newer medications that we use, and sometimes we get so bogged down in all these medications we forget the sort of foundations of good heart health, which are diet and exercise. And the problem is that there's such variability in what is a good diet, and but I think exercise is a little more clear cut. I think in general, people that aren't exercising, I wouldn't get into sort of vigorous exercise without at least seeking some amount of medical assistance in that. But people that are exercising regularly, 30 minutes of aerobic exercise up to 5 days a week is definitely beneficial. And then in terms of diet, it's a hard topic to just kind of give you one little tidbit that would get everybody on the right diet, but it's certainly something that you should address with your regular doctor.
For more information about heart disease in women, visit www.goforredwomen.org, and you can also visit hagerstownheart.com.